Thank you so much for joining us for our March Facebook Live. If you've been following us along on social media this week, you will know that it is World Glaucoma Week. This week, we've been sharing information about glaucoma and stories from people who live with this condition, which is the leading cause of preventable, irreversible blindness worldwide. So we really want to use this as an opportunity to help raise awareness and answer your questions through our initiatives this week. So to that end, today I am joined by Dr. Yvonne Buys. Dr. Buys is a recognized leader in the field and has held past positions, including the president of the Canadian Ophthalmological Society, president of the Canadian Glaucoma Society, and president of the Toronto Area Glaucoma Society. Dr. Buys retired from clinical practice in 2020, but she's still involved in research at U of T. And very exciting news, just this past week, Dr. Buys was awarded the International Scholar Award from the American Glaucoma Society, and she was the first woman and the first Canadian to receive this award. So congratulations, Dr. Buys, that is so awesome.
Thank you very much.
And welcome. Thank you so much for joining us for World Glaucoma Week. And I have some questions here that have come in already. And please, for anyone out there listening along today, if you have questions, please feel free to type them in, and we will do our best to answer as many of them as we can. So just to kind of start us off, Dr. Buys, what is glaucoma? What are the different types of glaucoma? Tell us a little bit about, just to set the stage.
Okay, so glaucoma is a word that describes actually a whole host of diseases. I think a lot of people have that misconception that glaucoma means just one disease. However, all these diseases share a common feature. It's a disease of the optic nerve, the nerve in the eye, the nerve that transmits the images that are seen by the eye to the brain. The optic nerve, you can think of it like an electric cable with a lot of wires in it. And these wires, we call them axons. And in glaucoma, these wires or nerve fibers get damaged, and it causes blind spots in the vision. And if it's left untreated, it can cause total blindness. Most glaucomas share the feature of elevated eye pressure, but you do not have to have elevated eye pressure to have glaucoma. However, all glaucomas are treated by lowering eye pressure. And just to give you a little bit of an understanding of what determines the eye pressure, there's a fluid that's made in the eye. It's called aqueous humor. It flows in the eye, brings nutrients to areas, and removes waste products as well. So when there's problems with the drainage of the fluid, that's when pressure can build up and can cause glaucoma. So as I mentioned, there are many different types of glaucoma, and we broadly divide them into open angle. So the structure where the fluid drains out is open, but for some reason is not functioning properly, or closed angle glaucoma, where it's physically closed off. And under each of these, open and closed, we have primary glaucomas, so that you don't really know what the cause is, and then secondary glaucomas, when other things have caused it. And I guess common ones would be a condition called pseudoexfoliation. So when you have a dandruffy material in the eye that clogs the drainage structures, that's a type of open angle glaucoma. Pigment could be released in the eye, blocking the drainage structures, causing pigmentary glaucoma. Blood can do it. So if you have an injury to your eye and there's blood inside the eye, that can block the channels as well. Some medications can do it, like steroids, specifically people who use steroids either as drops in their eyes or creams around their eyes. Inflammatory conditions of the eye, they can clog the drainage channels through the inflammatory debris. And sometimes that inflammatory process also acts like a glue and can close the angle. So inflammatory glaucomas can be open and closed. And then let's complicate it a little bit more. There's also congenital glaucomas. So I think a lot of people, when they think of glaucoma, they think of it as a disease for the aged population, and most glaucomas are. But sometimes children are born with glaucoma as well, and they behave a little bit differently, a little bit more of an aggressive disease.
That's very interesting. That was something I learned just in the past couple of years doing, Viewpoint. We've had a few speakers on, including yourself, talk about glaucoma, and I wasn't really aware that it really can affect people throughout the lifespan. I was kind of guilty of that as well, thinking it was a disease associated with, aging. So we have a few comments here I just want to add. We've got Kim from COS saying hello. We've got some congratulations coming in for your award. And we had this wonderful comment come in ahead of time from a woman named Swanee, who said, Dr. Buys saved my eyesight. I'm forever thankful to her. I had 5 trabeculectomies, word I still have trouble with, and years later, my eyesight is great. So I thought that was just lovely. People were very excited you were joining us today. It just is great. So you talked a little bit about some of the risk factors for glaucoma, so things like injury, maybe inflammation. What are some of the other risk factors? Like, who is at risk for developing glaucoma?
So the 2 most common risk factors, which we really have very little control over, one is aging. Definitely glaucoma is much more common as we get older. The other thing is having high eye pressure, which you would never know unless you're having a routine eye exam. Other common risk factors are having a family history of glaucoma and certain ethnic backgrounds, like African Americans are more common to get open angle glaucomas, and they tend to be a little bit more severe. And East Asians more commonly get angle closure glaucoma. One of the problems, though, like you could maybe identify the risk factors, but the problems are with glaucoma, the symptoms don't develop until the disease is advanced. So the symptoms are when you're starting to lose vision. And you would really want to have your disease diagnosed at an earlier stage. Because as you mentioned at the beginning, glaucoma is the #1 cause of irreversible vision loss. In the majority of people, we can treat the glaucoma and prevent severe vision loss. But to do that, you're going to have a better outcome if your disease is diagnosed earlier. And for this reason, it's really important that people have routine eye exams, not waiting until problems happen. And especially if you have a family history of glaucoma, then you would want to be examined a little bit earlier.
So that's a great point. And I wonder about that. I know when I go to the eye doctor to get my eyes checked, they always put drops in my eyes, and there's different tests that they do. I know sometimes I get like a little puff of air, or there might be a blue light. Which of those tests is what they do to test for glaucoma, the eye pressure?
Well, glaucoma examination is really a comprehensive exam. They should be doing everything. So it should start with measuring your vision. They should measure your eye pressure. And again, eye pressure is just a risk factor for glaucoma. So if your eye pressure is normal, it doesn't necessarily mean you won't get glaucoma. And there are also some people who have high eye pressure and never get glaucoma, but they need to measure your eye pressure. And there are, as you mentioned, several devices to do that. Some people will measure it with a puff of air. Other people will measure it on a slit lamp. That's the device where you rest your chin on something and the ophthalmologist is looking at you from the other side. And they have a small device, a little prism that they place on the eye, measure eye pressure. It doesn't hurt because you don't feel anything. They freeze your eye. Other things that are important to do for a full eye exam, and specifically in glaucoma, is to maybe measure the visual field. So that's when they do it with each eye separately, show a light, and you press a button when you see it. They may recommend that they do a scan. The common one is called an OCT, so a picture of the nerve of the eye, and it helps give a much better measurement of the structure of the nerve of the eye. And also maybe placing another lens on the eye to look at the drainage system to see, is the drainage angle open, or is there a risk that the drainage angle is going to close? So those are some of the main features that you would want to do for a complete glaucoma examination.
And you mentioned having a visual field test. So correct me if I'm wrong, but for like we talk about age-related macular degeneration, for instance, affecting the macula or sort of the central part of the retina. With glaucoma, the first sort of vision to go is in the periphery. Is that correct?
That's correct. They're almost like mirror image diseases of each other, especially in the early phases. So in glaucoma, typically you're getting small blind spots more in the peripheral vision. It's unusual that it would be early on in your central vision. And so during a visual field test, you're looking at a dot straight ahead from you, and then these lights are randomly shone all over with varying intensity. And they keep shining them until you don't respond to it anymore, that you don't see it. So, you know, it's a relatively long test. It takes at least 4 minutes per eye to do. And don't be nervous if you're not always pressing the button, because you're not supposed to be always pressing the button. But this is a way to get a measure of if there are blind spots. And then for people who have glaucoma, to measure those spots to see if they're getting larger. It's a way to know how glaucoma is controlled.
Yeah, and that makes sense too. You're talking about just sort of when the symptoms show up, you know, you've already have glaucoma. I guess your brain, you wouldn't necessarily know when you start losing a bit of that peripheral vision, whereas if it was right in the center, it might be more noticeable to you.
Yeah, and I think that's also because, you know, we have two eyes. So glaucoma, although most glaucomas will happen in both eyes, they're bilateral. Sometimes it could be one eye, like say if you had a trauma to one eye, but usually glaucomas are bilateral, but they can be asymmetric. So when you have two eyes, you may not notice if you're having problems with one eye, unless for some reason you close one eye, and then that might be the first time you detect something that could have been there for a long time.
Yeah, it's interesting how the brain really can compensate for a lot of that early vision loss in not just glaucoma, but in many conditions.
That's right.
It's really, really fascinating. So you mentioned some of the symptoms of glaucoma. Are there other symptoms that people should, I mean, again, I know you said that once those symptoms are noticeable, you likely do have some glaucoma. So what are those symptoms that people should look out for, or for people who have glaucoma, maybe symptoms that get worse that they should be concerned about?
Yeah, so as I said, most glaucomas, we call it the silent thief of sight, because you don't notice it until it's advanced. There are, though, a few glaucomas that can happen suddenly, and then people notice it. Like, for example, acute, that sudden onset angle closure glaucoma. That's a very dramatic presentation that a person can have severe pain in the eye to the point of actually vomiting. And they may notice blurring around lights because the cornea, the front part of the eye, starts getting swollen because of the high pressure in the eye. And so those people without those symptoms typically will go in to seek treatment. But unfortunately, because the symptoms can be so dramatic, it can easily be misdiagnosed in an emergency department where they think a person has a flu or a gastro illness and not recognize that the source of the problem is the eye. But the vast majority of people, when they start noticing it, they're starting noticing because they're having problems with their vision. And for people who have glaucoma, know that they have glaucoma, if they notice their vision's changing, you shouldn't wait for your next regular checkup. You should call your eye care provider and tell them you're having problems and try to get in sooner to be seen.
Absolutely. So I was going to ask some questions too about how, if there's any measures that people can take to help prevent glaucoma. But we also had a question from someone here who'd asked, following glaucoma diagnosis, can a good diet help preserve your vision? And if so, what foods or supplements help? So yeah, so what are some of the preventative measures that people can take?
You know what, glaucoma basically is not really influenced by lifestyle. So I think that there's very few things you can do in your regular life to prevent your glaucoma, or if you have established glaucoma, to try to slow the progression. That being said, for people who have prolonged head down postures, I've been doing my regular yoga during COVID and a lot of downward dog. You wouldn't want to have prolonged head down postures because that actually increases your eye pressure and could cause damage, especially in people who have glaucoma. The other thing is people who use steroids. So in my 30-year career, I did see a number of cases of young people who were putting steroid creams on their face, around their eyes for cosmetic issues, and ended up getting severe glaucoma for that. So I think you need to be very careful if you are putting steroid creams around your eyes or steroid drops in your eyes. Make sure that you are having your pressure monitored during those periods. But otherwise, the activity that you do, the foods that you eat, supplements, there's no real proven benefit for those with glaucoma. Now, I just came back from this meeting of the American Glaucoma Society, and we did talk a little bit about this, and I have published in the past that weight loss can be helpful with glaucoma. Well, it can lower your eye pressure for sure. Does it slow progression of glaucoma? That's not really proven yet, but weight loss and regular exercise can be good too. And in fact, some studies have shown that yoga could be good to lower eye pressure. But again, for most people, it's if you have glaucoma, it's following the recommendations of your doctor, using your medications regularly, and as importantly, returning for your follow-up visits on your set schedule. Don't miss those appointments. It's really important.
Absolutely. It's that monitoring that really knows, if things are stable or if things have changed, and then you can deal with them at a faster, have a quicker response if things are changing. So you just mentioned some about medication. So what are some of the treatments that are available for people with glaucoma right now?
We're really lucky that there are lots of treatments available for glaucoma. When I started over 30 years ago, we only basically had 2 medications. Now we have about 4 different classes of medications and multiple medications within the same class, which may all work a little bit differently. So there's a lot of medications for glaucoma. They're typically in the form of eye drops, which can be a little bit awkward to administer. And then for people with more difficult to control glaucoma, there are oral pills that you can take. The problem, though, when you start taking medication orally is you can have more side effects within your body. Whereas when you use eye drops, yes, you can get side effects in your eye, like a red eye or changes of the skin around the eye, but getting side effects in the body is a little bit less likely. Then beyond medications, we have laser treatments for glaucoma, which can be quite effective, but they tend not to be lifelong. And then there are surgeries for glaucoma. And again, that's another very exciting area. When I started practicing, we only had 2 types of surgeries we did. That word trabeculectomy, that you found a long word, and also inserting devices in the eye. And these were large devices called an OMID or Barvelt valve. But more recently, around 2009, there have been an influx of small stents, which they go under the category called MIGS, minimally invasive glaucoma surgeries, which have been kind of an exciting new addition to the treatment of glaucoma. So we have lots of options, medications, we have lasers and surgery.
And for the surgeries, the MIGS and the trabeculectomies, is that basically to help relieve pressure in the eye? Is that what the purpose of the surgeries are?
Yeah, all of the treatments. And, again, in 2020, the only way we treat glaucoma is trying to lower pressure. So medications, laser surgery, they're all aimed at lowering eye pressure through different mechanisms. And with surgery, it's usually trying to develop a channel to allow the fluid, the aqueous humor in the eye, to escape the eye. So either to escape through the traditional outflow pathways that are already in the eye, and that a good example of that would be the eye stent, or to escape to non-traditional pathways like creating what we call a bleb, like an elevation of conjunctiva. That's one of the mucous membranes that covers the eye. So the aqueous humor is directed to that area and then it gets dissipated. And that you would have in surgeries like a Zen implant and also a trabeculectomy. The other tubes that I talked about, an OMID and Barveld, also will have the fluid of the eye directed outside of the eye area, but further back. So you typically do not get a bleb with those surgeries, but it's a similar concept.
Thank you for that description. I didn't realize there were so many different types of doing it. That's really interesting. So I'll give everyone out there a last chance to send in your questions while I ask my last question here, which is from another question we got in advance, which is, I mentioned that you're still involved in research. Is there anything that you're doing in research that you're really excited about, or even just in the field in general? What research is really exciting you in glaucoma these days?
Well, you know what, a lot of my research is going into different areas right now. So I'm really interested in healthcare delivery. So I'm doing studies looking at the number of ophthalmologists and what the demographics of ophthalmology looks like in Canada, how that's changing in terms of gender distribution and age, and are we going to have enough ophthalmologists to serve our population? So that's an area I'm interested in. I do also, though, do some clinical research as well. And one of the exciting ones I've been doing is looking at doing virtual visual fields. So we've developed a Google headset that patients wear, and they put in a smartphone in it, and you can do your visual field like that, which allows you then to do your visual fields in the comfort of your home, and you can do them more often. And there's a thought that if you can do the tests more often, maybe we can detect change quicker. So this might really revolutionize things. Now, we started this study, interestingly enough, before COVID, but I think COVID has exposed vulnerabilities in healthcare delivery. And if you can have more tele-ophthalmology, telehealth, I think that that's going to be benefiting patients. And this virtual delivery of visual fields is one such example.
I think that's great. And, I think that's one of, if we have to find silver lining over the past 2 years, I think there has been so much more attention paid and innovation in the way that we can connect with people at a distance, especially for people, again, with glaucoma. Often it's an older population that may find traveling to somewhere more difficult for eye tests if they live in more remote communities. So I think that all of those opportunities would just be so wonderful, especially for patients.
Exactly. I think necessity is the mother of invention, right? And I think that we are going to have a better healthcare delivery because of that. That being said, I have also been doing studies of eye care delivery during COVID, and I think that we have had challenges. The government correctly responded, trying to allow a lot more virtual care for medical conditions, and I think that that was great. However, ophthalmology, I don't think is really as suited for virtual healthcare delivery, and we've been tracking the virtual visits, and it's very interesting. As soon as the government allowed patients more easy access to come and see their physicians, in-person visits for ophthalmology went way back up again, and much lower number of virtual visits. So I think it would be very hard to diagnose and manage a glaucoma patient virtually. So I think that patients with glaucoma or concerns about their vision, please remember, ophthalmology offices are open and you should still be coming in person to have your assessment done.
Absolutely. It's not, yeah, you think about any virtual appointments I've had with a doctor over the past few years, it's usually something you could, tell them about or take a picture. If you've got like a rash or something, like you could tell the doctor about that, they can see that, but they can't look inside your eye and do the dilation and all of those things virtually. Yeah. So it's still
they can't measure your eye pressure, exactly, none of it. So yeah, it's not a very effective way of managing eye disease.
Yeah. Okay, we have a bunch of questions that have come in now. So we have a question here from Reina. Reina says she has very dry eyes. Can she use eye drops for that?
Absolutely. So I'm not sure if she also has glaucoma, but unfortunately, one of the side effects of glaucoma drops is they can make you more susceptible to dry eyes. Absolutely, you can use teardrops as well. The only recommendation I would say is to not administer it exactly the same time as your glaucoma medication. Wait at least 5 minutes afterwards. And also, if you are on glaucoma medications, most medications have preservatives in them. So you could get a lot of preservative medications around your eye, which may increase adverse effects. So if you could find a preservative-free teardrop, I think that that would be a good consideration as well.
Interesting. I didn't know about the preservatives, but that makes sense that it could like further kind of dry things out, not really help the problem at all.
Mm-hmm.
We have another question here. How much does the eye surgery cost? How much does it cost to get eye surgery?
You're in Canada, and Canada has the Canadian Health Act, and anything that's medically necessary, you shouldn't pay for it. So there is no charge for eye surgery related to glaucoma. And in fact, cataract surgery should be able to be done also with no charge. Now, I do know that there are clinics that people go to and do pay for surgery, and they're usually paying for upgrades. But the government does cover cataract surgery, covers glaucoma surgery, and you definitely do not need to pay for it.
Fantastic. We have another question here from Linda. She says, do contact lenses affect pressure, and are they safe to wear?
So contact lenses do not affect your eye pressure. And yeah, there's a long history of people wearing contact lenses, and for the most part, they are safe to wear. You just have to be careful with your hygiene to make sure that you don't introduce any infections with your contact lenses. The other consideration is if you're using glaucoma drops and wearing contact lenses, it may decrease the lifespan of your lens. So I usually had advised my patients to try to instill their drops before they put their contact lenses in. And if the drops were twice a day, after they took their lenses out at night.
Okay, and just to be respectful of time, let's see, I think we'll do one more question. People are having conversations about different kinds of drops here. They're saying they have high-low drops, but they're pricey. High-low gel drops are the best for the heather. So everyone's kind of comparing notes on their drops.
Yeah, those are the preservative-free tear drops, and they are good drops, but they do have a price tag, yes.
So Sylvia's asking sort of what is a bad number for eye pressure? So you did talk about, high pressure can be a symptom of glaucoma. What sort of pressure should people be thinking about if they hear those numbers?
So eye pressure is very individualized per patient. I think it's important for patients with glaucoma to know what their eye pressure is, but they should ask their doctor, what is their target pressure? Because it can be very different. Some people can be controlled with pressures around 20. Some people will go blind with pressures of 12. So again, you cannot give one safe number for patients. You need to ask your doctor, what is your history of eye pressures? At what eye pressures was your disease still advancing to know what your individual target should be?
Yeah, I suppose it's also very individual too. Like if you have an eye pressure and you know what your eye pressure is typically, and then you see a big spike in it or a big drop in it, then you can kind of judge individually what that means for that particular patient.
Yeah, it depends a lot also on the severity of your disease. The more severe, the lower you want your eye pressure.
Absolutely. Well, thank you so much, Dr. Baez. It's been so informative and interesting as always. If you go on our Viewpoint page, Dr. Baez did a whole session with us back in 2020 on glaucoma, which is, you can watch there. It's a great session. And if you're interested in more about glaucoma, we do have another Viewpoint coming up this April, on April 12th at 3 o'clock Eastern. We're going to be doing a Viewpoint on glaucoma in focus. We're going to be joined by Dr. Balwantri Chauhan, who was just recently awarded a FBC research grant to talk about a new imaging technique that's going to measure optic nerve damage in glaucoma. And also we'll have Dr. Regine Kanji joining us, who's going to talk a lot more about the drops. So getting a bit more granular into what Dr. Baez talked about today, specifically about drops, how to manage your drops, if you're having any difficulty with drops. We're going to answer a lot of those questions. So I do hope that you will join us. Again, that is April 12th, and you can sign up at fightingblindness.ca. Thanks again, Dr. Baez.
And if I could just make one little thing as well, for people who really want to know more information about this or some of the other common eye diseases, there is a very good website called See the Possibilities. That's SEE, thepossibilities.ca. That's being put together by the Canadian Ophthalmological Society, and it gives you information about the 4 major eye diseases. It gives you a thing about risk factors and treatments, and there's also a small quiz so you can test your knowledge, but it's very user-friendly and really covers a lot of these topics as well.
It's great. I love hearing about all those resources that people can access now online. It's just fantastic.
Yeah, it is good. Yeah.
Yeah. Well, thank you again, Dr. Baez, and thank you to everyone who joined us today and asked your questions. I hope you enjoyed this, and hopefully we'll connect again soon at another webinar or a Facebook Live. Take care, everyone.